So many applications. Why doctors don't want to learn about this technique? It saves money and time. Good evening. My name is Dr. Rahmat. I'm a physician in a small village in Langkawi, Malaysia. I have been a doctor for 44 years, and I have developed a new harvesting technique of PRP called Langkawi harvesting technique. PRP is a short form of platelet, which is component of the blood-rich plasma, meaning it rich, the plasma, normal plasma is not rich. By definition, it is an autologous concentrations of human platelet in a small volume of plasma. That is PRP. The basic indication of PRP is rejuvenation and regeneration. It is estimated there's about 35 commercial technique, and my technique is one of the 35 and not patented. It is for public. The reason why I come out from Malaysia, because I have done enough for my country. So I have to share with the other countries. I have shared before since 2011, publishing it in the Facebook, because now is the time of electronic media. I have my own legacy in my country. I am a poet, I am a novelist, I am award-winning literary award, national level. So I am in Malaysia is well-known doctor cum poet, novelist, a person with two brains, thinking with two brains. Instead, we call it whole brain thinkers, and I want to promote whole brain thinker to the world. So children grow up playing piano, become a doctor, playing violin, become an engineer. So you use two brains, because I believe using two brains produce very productive, very innovative human, and solve the problem of many problems that we cannot solve, like cancer and other communicable diseases. We must have some answers to the cancer, malignancy. We don't have an answer. We still cut, poison by chemistry, and burn by radiotherapy. With this PRP, we can stimulate immune system by do what we call it PRP thymus regeneration. First in the world, I can regenerate immune dysfunction to this. Under autoimmune disease, the 150 diseases, we can change that thing, and some of the incurable disease like psoriasis, which I have proven injected stem cell plasma can be miraculously cured. Now we can start from the head. If you have baldness, alopecia areata, then you can inject the scalp with PRP. The new hair will grow. Now you go to the face, it's a facial rejuvenation. We can get rid of the wrinkle. You can make, if a person's face is dull, you can make it radiant. That's called facial rejuvenation. I can take a product of PRP called stem cell PRP, inject into the stylomastoid foramen. Within 24 hours, the bald palsy recovered. Whereas in conventional medicine, in about 3 weeks to 3 months, you use steroid, antivirus medicine. But here you can reverse that thing within, because in the PRP got BDNF, brain-derived factor. So the face, the neck, The shoulder, you can apply a partial frozen shoulder. And here, carpal tunnel syndrome, you just inject 4 point here, and 24 hours, the pain gone. Here at the joint, we have trigger finger. We can use stem cell to treat them. Normally, orthopedic doctor will use steroid. We can go to the chest. Young woman with tiny breast, we call it micromastia. So we can, otherwise you have to do implant. Now you can take PRP, inject into the between the mammary gland and the pectoral muscle, and you put both sides, and the breast will grow. That's why your tummy. When we have this global epidemics of obesity, you can use PRP to treat abdominal lipolysis. You can reverse metabolic syndrome. You can reverse fatty liver. For men also who have erectile dysfunction, and people don't talk about it often, I have treated so many times. At the back, we have PID, prolapse intervertebral disc. We can inject every layer, every level, about 23 injections into the interspinal space. Not with a small needle only. Okay, exactly. We have osteoarthritis. We have a lot in the Western society. They have hip joint replacement because of hip joint necrosis or osteoarthritis. We can inject. And next will be hamstring muscle tear. Ronaldo ran away like that, and then muscle got torn. Come for just PRP. Within 1 week, we can go to play football. So many applications. Why doctors don't want to learn about this technique? It saves money and time. Obviously, Big Pharma are not happy if this have been promoted, because it will affect their industry. So that's why many doctors are not interested to know the truth. I am telling you the truth. That I have a doctor in Argentina who used my PRP to inject into for the PAD, peripheral arterial disease. In Mexico, many technicians use my technique in the deep Amazon because there's no treatment. They are using a modified centrifuge from the blender. They convert blender into centrifuge. The first time the PRP been used by American doctor for the CABG, bypass surgery. After the bypass surgery, they inject PRP along to prevent medistinitis. The problem with my PRP harvesting technique, there is no institution, there's no university want to adopt, because no grant to give to say you need to take 100 patients with Bell palsy, double-blind study. You inject water and you inject PRP, stem cell. So no taker to my system. I have approached so many government. I went to my government, to the director of the medical development. He was my junior. Just look at the corner of the eyes, because they have tested PRP before with a commercial. They spend millions. So they concluded PRP is not effective, not cost effective, and nobody was to authenticate my finding, my result in scientific manner, because I am a village doctor. I live in a forest, 6 million years old, all forest my house. So they look at me with one eye. First of all, I don't develop the equipment. The equipment is available on the Alibaba, Amazon with just 163 euro and with 12 holes for unit that you can solve the problem. You buy 12 hole centrifuge which 163 euro. They don't want to know you can buy cheap centrifuge with 100 euro. You can buy 5. I got 5 centrifuge, cheap, all cheap. Buy online. Because I am from a village doctor, my patients in 60,000 population cannot afford to pay to go to cities because it's an island. They cannot afford expensive operation because there are fishermen carry load and they have damages of their neck and their back and their knees. So I look into the materials of PRP because it has growth factors. So patient will come, which I normally see about 140 patients a day, then the patient don't want to go for the operation, or they have already operated and put a kind of implant, titanium implant, and the screw get loose and the insurance company won't pay for the second operation. Now, my method of PRP is cheap. It's only 10 USD, whereas the commercially prepared is about 1,200 USD. So we take the whole blood from the veins very easily and put into the test tube. We can have 6 test tube or 12 test tube or 16. So we spin 350 RPM for 15 to 20 minutes. So the blood becomes separated into 3 principal layers: the plasma, the interface or Buffy coat, and red blood cells. This is the same like any other commercial one because they come with a machine. They sell with the machine, but mine it's a separate centrifuge, and the different with the other method, they don't have photoactivator. Mine we using tube, common tube, which costs only about €0.5. Very cheap. Then after spinning, we have the separation. We remove the PPPP, that means platelet poor. We remove the poor, we take the rich. And then we have 3 layers of separation: plasma, red blood cell, Buffy coat, and gel. This gel later become lice. We resuspend. We resuspend the thing until we get a PRP. Then we inject to the wound. Yeah, that is the resuspensions of resuspending PRP, and we have the final product. This is called premium. But if you collect all this premium into another tube, several tubes, and then we spin again for 4,000 RPM, 5 minutes, and we will get acellular PRP, and cellular PRP. Then we again remove the acellular PRP. We combine and spin another round, 4,000 RPM for 5 minutes, and then put this into LED and vibrator. LED with yellow, orange, and red illuminate the platelet, and the platelet, just like miracle, will produce nanomolecule, which we call it growth factors, PDDF, BDNF, so many, about 200, BAP, bioactive protein, chemotaxin, cytokines, and many others molecules. these molecules are important for initiating healing. For 2 years, she has delayed wound healing. You can see the edges of the scars around the is clean, but then no healing. He is not diabetic, but we inject stem cell plasma. That means that the difference between my technique and the rest of the world, 35 other techniques, they do not have cellular PRP, they do not have acellular PRP, they have only premium. But I have invented a system, a technique to harvest stem cell plasma, because 1% of whole blood is circulating stem cell. That's how our body repair. We have mini stroke, we have mini heart attack, we call micro heart attack. Who want to repair? There is a centrifuge in the brain called circle of Willis. The artery joint form like a circle, resemble a centrifuge. When it spins like that, the platelets become activated. Then they release temporarily the growth factors, the healing molecule, the magic molecule, the miracle molecule. You can name it, because you can see it can cause healing, initiate healing in only 2 months. Whether this 3-4 years have been there, no progress. But it also can be used in burn wound. You got burned, scalded with hot water, hot oil, because this lady, she hold the pen, they got fire, the oil got fire and dropped. She was panning, and then the pan dropped into her boiling oil. So she came to see me after 2 weeks. So I injected her shoulder. There's a picture. After 2 weeks, it becomes scar. If she has money, she come to see me, it will come back to normal scar. But other thing we can also, this is common, but to do PRP rhinoplasty for a person who have a low set nose, I'm the first in the world to do it. I have done about 12 first in the world, including breast augmentation, mastopexy, woman with a sagging breast, like just 45 to become menopause. So I inject PRP stem cells on the Cooper's suspensory ligament, and the ligament gets snapped. Now the joint become tight. I have done 6,301 PRP procedures, supposed to be the record in the world. I have done more than 40 workshops in my country, or using my slides. So I can be invited, I can be questioned, I can be examined, cross-examined about the technique before the doctor can adopt my technique. And there's no royalty. Participants of the workshop, which conducted by an organization like Spanish Medical Association, invited me, that I present, then I will just sell the slides. And the organizer can take the tape and sell it to the participant for that review. I can go to clinic and demonstrate injection procedures. Treatment, the regulations of the PRP in many countries are different. In Australia, it is almost every clinic have PRP facility, because it's a sport culture country. Everybody plays sport, and the sport causing injury, sports injury, all the tendon tear. That a simple single injection to the ankle can solve the tear, muscle tear or tendon tear. So simple as that. No need operation, cut down the cost. America now, few million procedures done a year, but expensive. 20 times more expensive than mine. In Spain, you can buy from Amazon 163 a 12 hole centrifuge for 163 euro. And then another one, you have to buy decorative LED light. Allow the photon from the LED light to activate the platelet and release the growth factors. And you can have vibrator, so it vibrates. So the tubes will vibrate, then the platelet will collide each other and release more growth factors, more BAP, bioactive protein, and it enhances healing when you introduce, because this growth factors is chemotaxis. It moves by the chemistry. Injured area, the PRP growth factor, they move automatically, move by itself. You just enter below the skin, they move by itself to the injured area and initiate cascade of healing. The stem cell from other parts migrate to because they communicate with the molecular signaling. It's very beautiful because we condense the platelets into rich. That's why they call it rich platelet-rich plasma. So it needs validation, and I'm seeking for validation. First, I travel from Malaysia to India, then to Cairo. Initially, the doctors in Cairo approached the manufacturer of the PRP machine. They studied my results so good, so they said, if this had been sprayed in Egypt, they cannot sell their product because it's too cheap. So they withdraw their sponsorship. So I went there with my own money, my own thing. I go to the village called Mansur. I give injection. The doctor is chiropractor. I just one layer, he did the rest. Then you can ask question, I will answer. The most important thing is not about the revenue. It is spreading of the knowledge, sharing the knowledge that we must share. I share. It's up to you to be skeptical. There are reasons you to be skeptical because you have interest behind it. But let's be fair. Give me a chance to present my technique, examine it, question it. I would love to answer. I appreciate you listening and watching this video. If you are interested, you can contact me at the Facebook under Rahmat Harun, without Dr. Rahmat Harun, and then go to the PRP Langkawi. So you can organize workshop. I can go to your workshop and demonstrate how to harvest, provided you have all the paraphernalia for PRP facilities, which is all cheap, less than 1,000 euro, which I feel the world will benefit, the humanity will benefit from the spread of a new technique which can save life.